Well, joining us on the show now, Dr. Sarman Singh, Senior Virologist and former Director of AIIMS Bhopal. We're also being joined by Dr. Romel Tikku, Director, Internal Medicine of Max Healthcare. Dr. Sarman Singh, let me begin by asking you, we're clearly getting, well, if not contradictory, conflicting messages now. We've just heard the government say that if we look at the kind of growth trajectory in the United Kingdom or France, if you translate that and if India follows the same kind of path in terms of Omicron cases, we could be looking at a potential situation where there could be between 13 and 14 lakh cases a day. On the other hand, there is, of course, this message that so far, at least, there have been no deaths due to the Omicron variant here in India. And patients who've contracted it so far have either been asymptomatic or had very mild symptoms. So, what is the big takeaway over here? Just how careful do we need to be in the days and weeks ahead?
You very rightly said that, there are some contradictions. People perceive like that, but there are no contradictions. Basically, the reason is that what, the government spokesperson, they were saying, and they were giving the examples of UK and France. So the number of the cases will be, because its infectiousness is very high, so many more cases will be there. So even if the death rate or fatality rate or severity rate is very low, even then, because the cumulative number will be too much, and therefore people might get panic. So that is the only worry, and therefore this is very important that we keep on assuring the people that they should adopt all the precautions and they should not get panic, even though it is asymptomatic in many of the cases or mild symptoms they have which are manageable. There is no death so far, because we in India have about more than 100 cases only, but the people are dying. In South Africa, there are people dying, and UK also people are dying, but as I said, because the number of the diseased or infected person will be so huge, right. This is expected as per epidemiological, the calculations. Yes. So even if the percentage of diseased or severely diseased or fatality rate is low, right. The number might be quite high.
Right. So you're seeing a situation where health systems could get overwhelmed simply because of the numbers of those who get infected at the same time. Dr. Tikku, given that we've been through that very devastating second wave, which was powered by the Delta variant, when we've seen situations in Delhi where hospitals completely struggled to cope up with the number of sort of very serious infections, the fact that the government is now issuing these advisories early, it's already saying, stop non-essential travel and, of course, follow all other COVID precautions that are already in place. Do you think that's going to make a difference?
Of course, yes, it will make a difference. We have to learn from our past mistakes. We saw what this virus can do in the second wave. And looking at the world, in particular UK, Europe, the cases are going beyond the roof. Doubling rate is 2 days in UK, 90,000 cases a day. It's already the dominant strain there. And even in US, and now in our country also, cases are going up, more than 100 cases. Delhi has 22 cases, and there's every chance that the numbers might go up. And the festive season round the corner, and we've also seen post-Diwali, post-Christmas, the cases might go up. And we have to be extremely vigilant. The government has to be very proactive, increase surveillance, increase testing, ramping up the infrastructure, everything is needed. But again, I would say we also have to be extremely responsible, all of us. So apart from the fact that you have to avoid non-essential travel, avoid large gatherings, celebrate from your homes, don't go out unnecessarily and wear a mask, follow COVID appropriate behavior and get vaccinated. There are enough people even now who are not vaccinated. And mind you, the negatives about this particular strain is that even if you've been infected in the past or you've been vaccinated, you might still catch it.
Right.
But if you are vaccinated, then the disease might not be that severe and you will not get hospitalized. Right. So I would say prevention is the key. Yeah.
Yeah. Let me also bring in Dr. Sanjeet Sasidharan of Fortis Raheja Hospital in Mahim. Dr. Sasidharan, when we're on the subject of vaccinations, as Dr. Tikku was also pointing out, there's ample evidence now to show that there are higher levels of vaccine escape when it comes to the Omicron variant, that you could be double vaccinated and yet, contract the Omicron variant quite easily. Having said that, why aren't we seeing the government really prioritizing a third dose, particularly for frontline workers and those with comorbid conditions? Would you say that, that is something that really now needs to be urgently looked at least?
So let's look at a scientific perspective in the first place. So, when we see real world studies in the past by the UK Health Security Agency, we can estimate that 2 doses of vaccine would give limited protection against Omicron. That is very, very clear. But a booster would raise it up to 75%. So you're getting it right that we need boosters. And I'm certain that vulnerable populations and healthcare workers who've got the vaccine way back in time are the ones that require it. Yes, we all need to press for it, and I'm certain very quickly we should get it through. The only thinking is that the vaccine, the entire committee that is deciding this has raised the perspective that they're waiting for the WHO to give us a go-ahead for this particular thing. But yes, vaccine boosters are required, especially for vulnerable elderly and the healthcare workers for certain.
Right. Taking up, Dr. Tikku, on a point that you already made, we're at the start of festival season. Then there's going to be a spate of elections in several states around the country, at precisely the time when perhaps, given trajectories in other countries, we're likely to see a huge spike in cases of the Omicron variant here as well. Would you believe early interventions are necessary, and, how can they happen?
Well, early interventions are required because, see, what we saw in the second wave was that we were not prepared for it. And that's why our healthcare system got overwhelmed. So that's why you need to have these travel restrictions in place. You need to make sure that increased genomic sequencing is happening. You catch the variant early so you know how it's behaving. And people have to be aware of the fact that this particular variant is different, that it has a tendency to spread. It's more transmissible than the Delta variant. And that's why the government is being so vigilant, so proactive. And all of us have to contribute in this, because otherwise the numbers spike again. We are no different from the rest of the world. If it can happen to UK, if it can happen to Europe, US, it can happen to us as well. And that's what we might be just lagging behind by 1 or 2 months.
Yes.
And once the numbers go up, even if the disease is mild, if large number of people get infected, the ones who are vulnerable or have comorbidities, they will be in trouble.
Right.
So again, the system might get overwhelmed.
All right. Well, dire warnings today from the government and words of caution from the doctors on our show as well. Thank you all for joining us on this discussion.